Live on both Facebook and Instagram. Alrighty.
Hi everyone.
We are back with Emily, you guys.
So we're back, and this time I'm doing laser hair reduction, and I have Sarah, one of our receptionists here, and we're going to be doing laser hair reduction on her legs. So this is a great treatment that saves a ton of time. It really is life-changing. And basically what we're going to do is we're going to do one of the treatments. We are currently in a series for her. And so what I recommend is for the legs, we're going to be seeing her every 8 weeks because that's when the hair is in the active growth cycle. And so it's a very comfortable treatment. We can very safely treat all skin types, from the fairest to the fair to the deepest to the deep, with this laser. So I'll just go ahead and begin the treatment. And you can go ahead and just kind of see how it looks. Sarah can kind of talk about how it feels. But as I said, our laser is very safe for all skin types, and it actually is very comfortable. A lot of my patients that have been treated in the past are very, very happy when they have to come in for touch-ups, which you will have to do for maintenance every couple of years. The laser does get rid of dark, coarse hair, but you will have to come in every couple of years for a couple of touch-ups, like 1 or 2, to maintain. And they're very pleasantly surprised if they've had treatments of the past that this laser is as comfortable as it is. You feel a little bit of suction, a little bit of heat, but that's about it.
What areas can you do?
So you can do all areas of the body. We're going to go ahead and we're going to start. So you can do all areas of the face, chin, upper lip, neck. You can do arms, legs, bikini, Brazilian. You can do, obviously, full legs are very popular. Underarms, also very popular.
Does this leave the skin rough?
Absolutely not. So after treatment, you really won't notice that you had treatment at all. You're not going to notice anything at all.
So will there be redness?
There may be a little bit of redness,
Okay.
but that's really about it. That will subside in about 30 minutes after treatment. And Sarah, you've had quite a few laser hair treatments. Have you noticed anything after your treatments?
No, not at all. And I actually think it's relaxing. It's really comfortable for me.
Should you let the hair grow before your first treatment, or do you need to be freshly shaved, waxed?
Great question. So unlike waxing, where you have to have 1/4 of an inch of hair before treatment, the laser doesn't actually want to see any length of hair above the surface of the skin, because it'll actually just incinerate that hair. So you actually want to be freshly shaven before your laser treatment. So come in freshly shaven. I would recommend shaving the night before treatment.
How many sessions for the lower legs areas?
So I would recommend anywhere from 7 to 9, and I would recommend them spaced 8 weeks apart.
And what kind of brand or laser is this?
So we use the Luminous Light Sheer Infinity, which is one of the best on the market and most comfortable.
The most comfortable.
How does the skin look right after?
Really, I mean, do you notice anything? I mean, it really maybe just has a little bit of like pinkness to it, but other than that, Sarah will be able to go on with all of her activities, and you know, life will be fine. She will be able to do whatever she wants.
Life as usual.
Yeah.
Does it help with the dark shadowing underneath the arms, or what would? They said I have very dark, coarse hair.
So eliminating that dark, coarse hair will help with that shadowing.
Okay, and then does it work on blonde hair?
It does not, unfortunately. So the laser needs to see a target in the hair follicle, and that target needs to have pigment. So unfortunately, the laser does not work on light white or blonde hair or red hair.
If someone isn't sure if they have dark enough hair or not, what would you recommend them doing?
I would recommend that they come in for a consultation, and we can go ahead and take a look and identify if the hair is in fact dark enough.
And if you think that you might be a candidate and you purchase this today, since our sales are only today, do not worry if you end up coming in for a consultation and we say that you're not a candidate for it. We will take care of you. We will find something that is going to be, that you are going to be a candidate for. We'll make it right. So if you're considering purchasing this, but you're not sure if you should, if you're going to be a candidate, better safe than sorry. Purchase it and then come in for your consultation, and we'll figure it out from there.
Absolutely.
Isn't it amazing how far we've come with the laser?
Oh, so far. So far. So there's no messy creams, there's no messy gels, there's no numbing required. I mean, all I'm doing here is I just turned on the laser, I plugged in her settings. There is a disposable insert that's single use and very sanitary for each person. So after I'm finished with Sarah's treatment, I'll just simply throw this away, and then I'll be finished with it, and I'll put in a new one for the next person.
What is the long-term care for this?
So basically, the long-term care is you're gonna save a lot of time in the shower.
Yep.
You're gonna have a lot of free time.
So there's no maintenance?
The maintenance is that you'll probably need to do some touch-ups. It's different for everyone. There's a lot of different factors in terms of hormones. Pregnancy plays a factor, but I would say you'll probably need to do some touch-ups once every couple of years. Maybe you'll do like 1 or 2 treatments every couple of years. But like I said, the hair will never be as dark and as coarse as it once was.
And what were the initial amount of treatments that you needed?
7 to 9.
7 to 9 in your initial series.
What about someone who has issues with ingrown hairs?
So this is actually a fabulous treatment for that, because this is really the best solution for somebody that has issues with ingrown hairs, because this is really going to eliminate that issue entirely.
I love that.
So I would highly suggest doing laser hair.
Is this also good for the bikini area?
Yes, I have tons of patients that do the Brazilian and the bikini.
And then can you apply lotion or deodorant afterwards? These are great questions, everybody.
Yes, such good questions. I'm going to have you rotate it, Sarah, for me. Perfect. So you can apply, I'm going to have you kind of move this leg just a little. Perfect. You can apply deodorant, and I just don't want you to apply fragranced lotion. So now is not the time after treatment to use your new Bath & Body Works fragrance body wash or lotion. I would keep it really simple and mild with something like Dove for sensitive skin. But yes, you absolutely can use deodorant, and you can use a very mild sensitive skin body wash or lotion. Just for like 3 days or so, 72 hours, and then you're fine to use whatever you'd like.
Okay, let's see. Will you eventually not need treatments anymore, or will you always need treatments?
I would say you're probably going to always need treatments, because laser hair removal is a misnomer. There's no laser that removes the hair completely. It's laser hair reduction.
Okay, and then lots of people asking where exactly you can do it. It's a lot of areas. You want to go through those again?
Yes, so starting from the face, the upper lip, the chin, the neck, the cheeks, moving down the body, the underarms, the legs, the bikini, or the Brazilian, depending on what your preference is. And then we have the full legs, we can even do like knuckles.
Someone asked about the toes.
Yes, toes are always included in the legs. Very important. We can't neglect the toes.
Do you want to share with everyone about the growth cycles, like the hair growth cycles?
Yes, so hair grows in different cycles in each area of the body. So with the face, we would be treating you every 4 weeks, because hair grows faster on the face. With the trunk, the hair would be growing every 6 weeks. So for instance, the underarms and the bikini, I'd have you come in every 6 weeks. And then for the legs, the arms and legs, hair grows much, much slower. So we would have you come in every 8 weeks. I will say consistency is key with your treatments. So my patients that have the best results are the ones that stay on course with their laser hair removal and come to their appointments every 4, 6, 8 weeks.
Someone said how much needs to be grown out. You want it freshly shaved.
Freshly shaved, no hair above the surface of the skin.
And it does not work on red or white or super light
Or
hair
blonde.
or blonde.
Yep.
How blonde? Like dirty blonde or
Any shade.
blonde?
Yep.
Someone said, how awkward is it to get a Brazilian done?
Not awkward at all.
Emily feels comfortable
I
with
feel
it.
totally fine.
We're all women. We
Exactly.
all have bodies, men and women.
Yes.
What would you say to someone who has never done this and they're like, okay, I'm just going to go online and purchase this? What would you say to them?
I would say do it. It's a great investment. It's life-changing. It is worth it. And it really does make so much sense. It's an investment up front, but in the long run, it saves so much time in razors, in waxing, in threading. If you just add it up, it is just so much time and money that you're spending now when you could be done with all that and just be hair-free in the long run.
Do you need to be careful if you are on certain medications?
Absolutely. So you cannot be on any antibiotics because they are very photosensitizing and can make you sensitive to light-based devices. So I would need to know if you are currently on any antibiotics, specifically like doxycycline or something like that, because I wouldn't be able to treat you. That's very important.
Awesome. Are there potential side effects?
No potential side effects, no.
Smooth legs, that's your side effect.
That's right. Smooth legs.
Great way to save time. Women supporting women. Let's see. People are saying they love laser hair removal.
This person says, I'm very pale and I have blonde hair. I've always wanted to try this, but I hear it won't work. So how light can hair be? That's a big question. These poor blonde-haired people.
I know.
Yeah.
And if my hair's too light, would it work if I dyed it? If only.
I get that question a lot. Unfortunately, it won't work if you dye it because the laser is targeting the hair in the actual follicle. So it won't work if you dye it because the laser is going much, much deeper than the actual hair.
How long do you need to be off antibiotics before getting a treatment?
1 month.
Do you recommend doing one area at a time?
No, I have patients that come in that do multiple areas at a time. They do their legs, they do their bikini, they do their underarms. They do 4 or 5 at a time.
Yeah.
They just come in and knock it all out.
How many men clients do you have? Do you have men that come in and do this?
Sure, they do their backs, they do their chest, the back of their neck. Men want to be hair free too.
Beards.
Yeah.
Let's see. They said, is this the same kind of IPL that you do on the face and neck?
So this actually is not IPL. This is a totally different machine than what I did before. So this is a laser entirely. This is not IPL. This is an actual true laser. This is completely separate. This is not the same machine. So whereas IPL, I used ultrasound gel and I had to, numb the patient before. This requires no gel, no numbing, no messy cream. So this is an entirely separate machine.
And how long do the underarms take?
Oh, the underarms are so fast, probably 10 minutes from the time you walk in until the time you leave.
Okay, and then let's see. Does this help get rid of spots too? Sunspots, I take it?
Oh, no, it does not help get rid of sunspots.
That's IPL. This is laser hair removal or reduction. Let's see. This person said, I had my legs, bikini, and underarm areas laser treated. It was the best decision I ever made.
Awesome.
Let's see. Can it cause permanent bumps?
It cannot, no.
Okay. And then
It removes those bumps.
Yes.
pain level.
And what do you think, Sarah?
I would say a 0. Not
0.
at all.
You heard it from the patient's mouth.
Yep.
Let's see. Is the feeling of this treatment similar to IPL?
No, it is not. So this is actually very, very, very comfortable. I mean, this is at a 0. I would say probably with IPL, you feel that maybe a little bit more, like a 2 or a 3, but this has virtually nothing. I mean, she feels nothing. She's extremely comfortable. You feel this is very relaxing. You said.
I think so, yeah.
Yeah.
Website to buy.
Someone said, I'm using hydroquinone for melasma. Can I still get laser hair removal on my face?
You can, yes.
Okay, we got another one of these. How many treatments are needed for full permanent hair removal?
Okay, so it's never going to be full permanent hair removal. So it's laser hair reduction. So you will have to do touch-ups in the future, but you're going to need to do somewhere in the vicinity of 7 to 9 treatments, and they're going to be spaced for the legs, for instance, 8 weeks apart.
So what do you tell those people that get like one treatment done and then they're like, oh, I see results, I'm done?
Well, you probably will see results after one treatment, you know, because it is a difference if you go from, 0 to, all of a sudden doing something, 0 to 60, for instance, but your hair will go back to normal after you stop. So that's why you have to continue with the series, and you have to keep going, because if you don't, one treatment is not enough to weaken, damage, and destroy that hair follicle completely. You have to continue on with an entire series to really get to that hair follicle and destroy it entirely. Because the light is what damages the follicle, and one treatment is not enough for that.
Yeah. So we recommend the number of treatments for a reason. And I can even speak to that because I got lazy and stopped doing it after 3 treatments because I noticed a difference and I didn't finish it. So it all came back.
Yeah. That's the thing, yes. And like I say, consistency is key. You really have to be consistent.
Yep.
Thank you, Emily.
Yeah, of course.
People are saying so helpful. Thank you so much. This person said, I love these live videos. They're extremely informative.
Good, I'm
And
so glad.
this is not just for if you have a crazy, outrageous amount of hair. If you have a normal amount of hair, you still want to get rid of it.
Yes, absolutely.
Everyday person.
This is for everybody.
This person said, Emily took off my ugly hairs off my toes.
So they said, so if you stop doing this for a period of time, let's say 3 years, then would you have to start the whole process over again?
No, not if you did a full series. No, if you completed the series, then no, absolutely not. You would probably just need to do a few touch-ups.
This person asked, do you have to stay out of the sun?
Immediately after the treatment, you do have to stay out of the sun, but actually now is a fabulous time to be embarking on laser hair because sun exposure is at a minimum, so we really don't have to worry about things like that. But yes, immediately after, I would not want you to be in the sun for at least 7 days. Would it be like summer or something like that?
Okay. Alrighty, well, our live is coming to an end. So if we didn't answer any of your questions, please text us at 314-991-5438. And we have lots of people sitting around waiting to answer your questions, help you pick out packages and treatments for you. So yeah, thank you all for tuning in. Thanks Emily.
Guys.
Is that the right number?